today, and we're going to be speaking about California's healthcare exchange, which officially opened October 1st of this year. And we're hoping just to get some information out to everybody from the statewide capacity and from the local capacity, just to give everybody an idea of what we're all working towards, and then also how ACA integrates with CalFresh Outreach. Our first speaker will be Angela Shing. Angela works for the San Francisco Human Services Agency under the capacity of the Affordable Care Act liaison. So I'll turn it over to Angela.
Thanks so much, Liliana. Okay, so essentially today I wanted to do I'm going to go ahead to the agenda slide, to do an overview of the Affordable Care Act, including touching on Cover California as well as the Medi-Cal expansion. And then mostly to talk more about no wrong door, or basically when and how to enroll, as well as horizontal integration, which is the concept that we're looking at the client as a holistic person and what they're eligible for. So when they come in for health care, we're actually looking at them for other programs such as CalFresh and CalWorks. And then the last thing I wanted to wrap on was what community partners can do, or some resources that might be of use to you in terms of outreach to your client population. So for ACA overview, healthcare reform big picture. I always like to start by just noting that ACA is the most significant social policy change since welfare reform in 1996. 35 million Americans will gain access through ACA2 health coverage. But the thing that I really like to emphasize is that this reform really is coming from federal down to the state, down to the local, all the way out to the community partners. And it really is an unprecedented collaboration between all of these different levels of government, as well as really into the local community, and what a huge part the community partnerships will play in terms of the success of outreach and enrollment. So we talk and hear a lot about the millions and millions of people that are actually eligible to these new healthcare options, but in reality, eligible really only turns into enrolled with the help of the community out to local, state, and federal government. So I always like to make that note that we are truly making history. So health reform, what is it? Two big pieces really that everyone hears about is the individual mandate, which is that it requires most people to have insurance. There are some exceptions, which I have listed here: the undocumented immigrant, hardship, very low income, incarcerated, qualifying for religious exemptions, as well as members of American Indian tribes and Alaskan Natives. There are penalties for noncompliance unless you fall into one of these exception groups. So that is something important to note for your client population. Let me see. In terms of the expansion of access to affordable health coverage options, there's quite a bit that actually happened with ACA. It did make significant market reforms. Some of the things that people hear about is you can no longer deny someone coverage for a pre-existing condition. Also, coverage on your parents' insurance was extended up to age 26. So those are two big ones that I think a lot of people hear about, that this doesn't just affect the low-income or uninsured population, but ACA reform to healthcare actually did affect every single person that has health insurance. So it is actually a pretty wide sweeping change. There is also the portion of employer-sponsored coverage. So there are stipulations for large business as well as small business. With large business, they actually will have requirements starting in 2015. For smaller business or below 50 employees, they actually have tax incentives or their own marketplace to help them enable those groups to be able to offer group or employer-sponsored coverage to their employees. I won't really go into too much on the business side of it. Today we're really going to focus obviously on the individuals, and particularly the low-income population. The ACA also requires provision of minimum essential benefits, and you'll often hear about the 10 minimum essential benefits. You could actually find the full list of them on the Covered California website, which is coveredca.com. But all insurance plans actually have to abide and have these minimum essential benefits, which again is another massive change to healthcare. The two things really that are going to affect our population, which is the CalFresh target population, is the expansion of Medi-Cal eligibility, as well as these new online insurance marketplaces, which in California is called Covered California. Okay. So these two things really expand access to particularly low-income populations. The Medi-Cal expansion actually, the traditional Medi-Cal program will continue for seniors and persons with disabilities. But the Medi-Cal expansion, or sometimes you'll hear it referred to as Magi Medi-Cal, and I'll go into that a little bit in the next slide, what Magi refers to. But essentially, it's modified adjusted gross income. For this new Medi-Cal expansion population, the eligibility determination is based on that Magi income, which comes off of your tax return. The big change with Medi-Cal is the low-income, childless, single adult population, 19 to 64, with incomes less than 138% of federal poverty level. They will actually now be eligible to Medi-Cal. And Medi-Cal, just a reminder, will continue to be a year-round enrollment. The contrast there is the Covered California Health Insurance Exchange, which everyone hears about more so when you're talking about healthcare reform and ACA. The Covered California Health Insurance Marketplace is actually open to anyone, any individual that wants to go there and purchase insurance. For those between 138 and 400% FPL, there's actually subsidies or help to pay for that purchased private insurance. Below the 400 FPL, the individual would be eligible to premium tax credits, a program called Advanced Premium Tax Credits. Below the 250%, they actually, in addition, would be eligible to cost-sharing subsidies. And cost-sharing subsidies actually aid with the out-of-pocket costs, such as the co-insurance or things like that when you're actually at the doctor's office and paying for the out-of-pocket costs. The financial subsidies are actually on a sliding scale, depending on where you fall in the income range. The enrollment for Covered California actually is a specified period each year. In this initial year, it is an extended period, and it began October 1st and will go through March 31st of 2014. On an ongoing annual period, the open enrollment period will be October to December for the Covered California period. The exception to that is if there is a qualifying life change, such as marriage, divorce, job change, death, birth, then you would have within 60 days to enroll into the Covered California outside of the open enrollment period. Okay. So just to touch on that a little bit more on how Medi-Cal specifically is changing. Just a reminder that the traditional Medi-Cal will continue to exist for seniors and persons with disabilities. And when I say traditional, I essentially mean Medi-Cal program as it exists today with the same rules that it has today. Where the Medi-Cal expansion population, or we'll sometimes refer to it as the Magi or Modified Adjusted Gross Income or expanded Medi-Cal, will now cover the low-income adults 19 to 64 with the FPL below 138%. A big change with the expansion population is that the asset test will be eliminated for Magi Medi-Cal or expansion Medi-Cal, where the asset test will remain for the traditional Medi-Cal. The traditional Medi-Cal stays exactly the way it is today. The change is only, or I shouldn't say the change, but the new rules for Magi Medi-Cal does not have an asset test. The expansion Medi-Cal benefits package will be the same as the traditional Medi-Cal. So essentially, I almost like to characterize it more as the Medi-Cal program. There's just a new group that will be part of the Medi-Cal program. The other important note that I usually make is that the application process, the intention behind healthcare reform is to make the application process very streamlined so that there's actually one application the client can use to apply for Covered California with no subsidy, Covered California with a subsidy, as well as the Magi Medi-Cal or traditional Medi-Cal. It's one application for any of those programs. And the idea there, again, is to make it a no wrong door for the client. They aren't figuring out what they're eligible to and then going to Covered California or asking to apply for traditional Medi-Cal. It's one application and they apply for any of these programs, essentially finding the right health coverage program and financial assistance for their particular situation.
Just a reminder, Angela, I'm sorry I didn't get to tell everyone. If you have any questions, please make sure to type them into the question box, and we will be answering the questions after Angela's presentation.
Great, thank you. Okay, and then Covered California, or the health exchange. Essentially, at the federal level, they are requiring that every state have a health benefit exchange, which is essentially intended to be a consumer-friendly marketplace for individuals to buy health insurance. In California, our health exchange is actually called Covered California. Individuals with the modified adjusted gross income, or the MAGI, between 138 and 400% FPL may qualify for those tax credits or the cost-sharing subsidies that I spoke about earlier. The benefits are standardized. Coverage is guaranteed. Rates may not be based on health status, which goes back to the you cannot be denied coverage based on a pre-existing condition. And it's available to uninsured Americans who have income above the Medi-Cal threshold. And the real important note that I like to emphasize is that essentially health insurance, the only factors to determine the pricing is location and age. So again, it can't be based on other factors like the pre-existing conditions is the big one that usually comes up. Okay. So this chart usually I like to just cover briefly. It's really just meant to be a snapshot of the things that I just went through. So essentially at the very top you can see there's Covered California without a subsidy. There's no income limits there. Anyone can purchase insurance through Covered California who don't currently have insurance through other means. Within that, if we go on the left side, it's referencing children, and if we're on the right side, we're referencing adults. So what I try to do here is translate the FPL into harder, actual, tangible dollar figures. So looking on the next tier, the below 400% FPL, or $45,960 for annual income for an individual, $94,200 for a family of 4 based on 2013 federal poverty level. Below that level, you could actually get a subsidy in Covered California. So either the premium tax credits, or if you're below 250% FPL, you'd also qualify to get the cost-sharing subsidies. At the 250% FPL, below that threshold for children, you would have the Medi-Cal eligibility. And then if you look on the right side below the 138% FPL, that's the eligibility level for adults. And I did just make a note here again that traditional Medi-Cal will continue for seniors and persons with disabilities. They are not subject to the MAGI rules. They would still continue to exist under the current traditional Medi-Cal rules. So just to give you a sense of the volume or scope of what we're looking at, I did leave in here the San Francisco specific numbers, but then also the statewide numbers. On the Medi-Cal expansion, you can see statewide we are estimating that about 3.8 million will be newly eligible or are currently eligible but not enrolled today. So we anticipate when people start coming in to apply for health care, that group will also enroll into one of the new healthcare options or existing option, whatever they're eligible to. On the right side with the Covered California tax subsidy, or essentially that group that's below the 400% FPL, you can see statewide the estimate is about 2.6 million are newly eligible for that program. Okay. So I'm going to move into when and how to enroll in this concept of no wrong door. But essentially to give you a snapshot of the timeline, you can see that right now we're in October of 2013 and we're in what's called the pre-enrollment period. Essentially it's really open enrollment, but we call it pre-enrollment because the new health coverage options don't take effect until January 1st. Once we get into January 1st, the open enrollment for Covered California continues through March 31st, but just a reminder that the ongoing enrollment for Medi-Cal just continues just as it does today. The note 2, again, just emphasize that consumers can also apply for Covered California within 60 days of a qualifying life change, things like marriage, divorce, death, birth, job change, or things like that. Let's see. All right. So how to enroll no wrong door. The real emphasis here, the reason why we call it a no wrong door, is because you can use any of these channels listed here to apply either for Covered California or for Medi-Cal. So an individual could go online to the Covered California site listed here, and they can make it one application, and they're applying for the gamut of Covered California or Medi-Cal products. They'll be determined eligible for whichever financial assistance or program is applicable to their situation. The same thing on call, visit, or mail. So on the call, there's I gave you here the Covered California number and their hours of operation. The client could also go to the local county social services office, which I didn't list. The hours may differ according to whichever the local county is. What I did do is provide a link at the bottom of the slide for your local county social services office, where you can look up their in-person locations, their phone number, as well as their hours of operation. Again, with the visiting, you can visit the local county social services office. I also did include a link on Covered California. There is a program called the Certified Enrollment Entities, which are local community organizations throughout the state who are actually trained, background checked, and then certified to actually be able to enroll clients into the Covered California, or to take an application and then make the referral for the Medi-Cal program. That actual application would ultimately land with the social services office, who will make the final eligibility determination. But essentially, these certified enrollment entities can take applications for both Covered California or Medi-Cal. There's also the mail-in option, which, again, I listed the Covered California mail-in address, or you could mail into your local county social services office. The big thing that I really like to emphasize on this page, though, is the intention with the Affordable Care Act is that it makes it super easy. The client can really go wherever it is they're comfortable, and they will get the same level of service, and they will get the right product for them, whether it's Covered California or Medi-Cal. Locally here in San Francisco, we definitely struggled with trying to make that an easy message to our clients, because we were concerned that if you provide all of these options, it actually gets a little bit overwhelming, and that the client then gets more concerned about which program am I eligible to. Should I be going to Covered California? Should I be going to the social services office? What's the quote-unquote best option? And I would, obviously defer to the local county where that client is. I know here in San Francisco, we really like to emphasize that it honestly really doesn't matter. The client should go to whichever of these options are most comfortable for them, because in the end, they will end up at the right place to get whichever product is appropriate to them. So the no wrong door, again, the single streamlined application, just again wanted to reemphasize that there is one application. It actually can be downloaded from the Covered California site, and you can apply for any of these products, which are generically termed the Insurance Affordability Programs, the IAPs. So that one, and it's called the single streamlined application, can actually make an application for any of these programs. I will say, we joke a little bit that the single streamlined application is actually 27 pages long, but some of it is instructions and things like that. But again, the intention really is to make it one-stop shop for whatever healthcare program is appropriate for the individual circumstances. The other thing to note that I want to segue into is the option to request a referral for other social services, such as CalFresh and CalWorks. And this is the concept of horizontal integration that, again, has been very, very put forth with the ACA and the healthcare reform, and the idea of treating the individual as a holistic person rather than having them come in and apply for CalFresh, and then they have to make a different application for healthcare and a different application for CalWorks or whatever other services they may be eligible to. The idea really is to make it, again, a one-stop shop where they make one application and are applying to everything that they may be eligible to. Okay. So this I'm going to segue into horizontal integration. I did attempt to try to pull together some estimates in terms of newly eligible the existing CalFresh population that will become eligible, newly eligible for Medi-Cal, as well as vice versa. The newly eligibles or people traffic that will come in for healthcare, whether it's the new programs or the existing programs, that we will then be able to enroll into the CalFresh program. So essentially, they're currently eligible, but for some reason are not enrolled. we really see the traffic coming in from healthcare reform as another outreach opportunity to get those people enrolled who are currently eligible to the CalFresh program. So I wasn't able to find statewide estimates, but CWDA did forward this great slide that kind of depicts a nationwide estimate that 98% of people eligible for SNAP will be eligible for Medicaid or Medi-Cal in California. 63% of the people eligible for Medi-Cal will be eligible for SNAP. That's some significant overlap. I think actually Kim McCoy-Wade is speaking, and I'm sure she has a lot of really great information on that vein as well. Okay. So to give you an idea, I didn't have statewide stats, but I do have some numbers for San Francisco just to give you an idea that in San Francisco, we're anticipating new enrollment into CalFresh at about 27,000 new individuals just coming in the doors because of the ACA horizontal integration. And then for existing CalFresh clients that will become newly eligible to Medi-Cal, we believe that about 24,000 of our existing CalFresh clients, or the vast majority, will become eligible to Medi-Cal starting January 1st, 2014. About 3,300 of that 24,000 for us here in San Francisco will automatically enroll into Medi-Cal because they're part of SF PATH, which is San Francisco's LIP or low-income health program. I'm not sure, just a little background, low-income health program is essentially a bridge to healthcare reform. It was an earlier federal program put in place to essentially almost pre-enroll people who are eligible, will be eligible January 1st, are enrolled currently in the LIP program and will automatically be enrolled into Medi-Cal come January 1st. Let's see. The other note I don't have a slide on, but I did want to mention, I'm not sure if people have heard of the Express Lane program for CalFresh. It's still being worked through. There literally aren't any, no meat to the bones yet. But there is, I'm sure people on this call probably have heard about, there's a portion of the ACA that makes it possible or puts in place the opportunity for states to have proposals to do an automatic enrollment of the CalFresh population into Medi-Cal. The state of California right now is looking into a program and gathering information to determine how they might be able to make use of that waiver. So there is a project called the Express Lane project right now that's looking at exactly that, how to bridge the CalFresh population and almost make them categorically eligible in a sense to Medi-Cal and how they might be able to expedite that process. So in terms of human services agency role for healthcare reform, really the shift is going from a client coming in and saying, I want to apply for this or I want to apply for that, and really having the client come in and have human services look at that person as a holistic individual and asking or immediately determining what are they eligible to. So this graphic really is meant to represent that the human services agencies now will be doing the traditional Medi-Cal as we always have, which is the bubble at the bottom. We'll also be doing the MAGI or the expansion Medi-Cal, which is the bubble at the top. And then the bubble to the right is the Covered California programs. We'll also be enrolling clients into that if we find that they're eligible to that. And the last bubble on the left really is this concept of horizontal integration, where we want to look at people in terms of integrated services. You're coming in for healthcare, but you're also eligible to CalFresh. You know, that's a benefit that you're eligible to, so let's go ahead and get you enrolled in that as well. So the last section of my presentation, I really just wanted to touch on what can community partners do. So I definitely get this question a lot, and I've been sort of lumping them into two areas, helping get the word out as well as helping clients to enroll. So the first thing really is things like this webinar to get educated on the different options, how the client can enroll, when the client needs to enroll, and the different programs that they might be eligible to. I would definitely consult your local county social services or health department for their resources. They might have outreach materials. They might have a specific message in terms of directing people more towards the number for social services versus directing them towards the number for Covered California. I believe different counties are probably taking different approaches in terms of what makes most sense for their target populations. There's also two programs or two resources that Covered California have. There's the Covered California Outreach Materials, which is downloadable from their website, and I have another slide to give you the link to that. And there's also the Covered California Community Outreach Network, which is an actual group that you can sign up for to get materials, and I believe maybe even have speaking requests, but there's just a little bit more material than just what's readily available on their website. Actually, I'm going to skip forward to that slide so I can show you that. But on the outreach materials, the coveredca.com/resources, they have materials, fact sheets, various things that are available for download and use there. I believe they also have a logo, a Covered California logo, so if you wanted to link from your website to their website, you could use that too to do a real clean link if you wanted to direct people directly to the Covered California site for those resources. Then there's also the Community Outreach Network. Purpose is to increase awareness and understanding of healthcare coverage and motivate Californians to take the steps necessary to enroll and remove barriers. And the link is a little bit lengthier, but that's the link to actually find out more about their outreach and network program, as well as to apply to be a part of the program. Okay. The other half of this is helping clients to enroll. So if people haven't heard of the Certified Enrollment Entity Program, I think I might have referenced this earlier, but essentially that's a program for community partners to actually be trained. There is background check and fingerprinting. It's definitely a process to get certified to actually aid individuals to enroll in either the Covered California or make applications to the Medi-Cal program as well. Knowing where to direct clients in terms of the local county options for online, call, visit, mail, and if you do have or provide public computer access at your site, including a link on the desktop so that clients could go ahead and use your computer to enroll themselves online if that's something that they're comfortable doing. And I do have a slide on the Certified Enrollment Entity Program. So again, the other mention I should make on the Certified Enrollment Entity Program is that for organizations that are certified, you do get $58 per successful application filed for Covered California. There is a complementary program being worked out now in terms of a $58 per successful Medi-Cal application filed. And I believe that's being worked out right now, so information will probably be coming out soon if it's not already starting to be floated out there, but it's not in place yet for the Medi-Cal side. For the Covered California side, the links here would give you more information to find out about that program as well as to apply for the program. Okay. And that essentially is everything I had. And basically get covered. Affordable Care Act, history in the making.
Thank you, Angela. So we're going to open it up to questions on your presentation. And just a reminder to everyone listening in, if you have any questions for this first part of the presentation, please put them into the question box that should be on the right-hand side of your screen. We do have some questions for you already, Angela. So what is the verification process for low-income people or people claiming hardship in order to opt out of getting health insurance? Okay. So that's two questions, verifications and then also for the hardship. Mm-hmm. So on the verifications, one of the big things with the Affordable Care Act is that they predominantly are making this an electronic process. So when the client applies, they will be asked as part of the process whether they give consent to that. And if they do, there's this system, I guess, called the Federal Hub. And essentially, when we or the enrollment people are entering the person into the system, it will ping or go and get information from this Federal Hub to verify almost everything, particularly with the Covered California application. With Medi-Cal, there is I believe it's residency and income. I think I'm going to have to get back to you on that. I know it's two things. It's residency, and there's one more piece that generally does end up needing some sort of verification, but generally speaking also with this population, we'll be able to verify them through other means, such as documents that we have on file here at the Human Services Agency. Mm-hmm. So again, that might differ a little bit depending on what county you're in, but I think that's pretty standard that most social services agencies will have a lot of that information on file already. So with the Affordable Care Act, I guess the bottom line really is the main thing is we will do everything to verify through electronic means when we can, and only when we can't, or if it's different from what the client is reporting, will we actually give the client the option to bring in documentation. So if the client wants to bring in, doesn't feel that the
electronic information is accurate, they can always bring in documentation to back up what they're saying. In terms of the hardship or the exceptions on the individual mandate, that's actually being worked out at a much higher level. I don't think there's any, there aren't specific direction or guidelines in terms of how to apply for those hardships. There is some information on the Cover California site right now, but as of my last update, that hasn't been finalized as to how to do that.
Okay. So a question, and I think this is related to the online applications for CalFresh. So how can people submit a partially complete application? So for CalFresh and in some counties, you can submit online applications and you can do it in a few parts. Is that going to be similar for the Covered California application?
So for the referrals from the single Streamlined app, that's actually not an application. There's a section in the single Streamlined app that asks if you want to be referred for other programs. Mm-hmm. If you check that box, then the local county social services would go ahead and do the follow-up to make a formal application.
Okay. So if someone is applying for CalFresh, say they would just click the Medi-Cal button, and then the Medi-Cal side would get a hold of them.
Oh, I'm sorry. So you're saying if it's a CalFresh application, yeah, versus applying for healthcare with the CalFresh referral?
Well, that was the first question, but I guess it's my follow-up question. So the first question was, what does someone absolutely need to provide in order to apply for the health side, and if they can submit a partial application, or does it have to be the full completed application? And then the second part was, on the other part of that is if someone is applying for CalFresh only, and then they're asking for a referral to Medi-Cal, would they then need to go back to another site, or is the county Medi-Cal office going to follow up with the participant?
Okay. So on the partial app, if you're applying through one of these healthcare channels, the online app will have edits in it so that you will have to fill in the minimum fields in order for you to actually be able to submit the application. Okay. Did that answer the question on the partial app from if you're coming from one of the healthcare options like Cover California?
Yes.
If it's the CalFresh only app, then or starting with the CalFresh app, my assumption is you'd actually be going through one of the SAWS portals, meaning Benefits CalWin or See for Yourself, or I'm not sure what the LA Leader one is. Mm-hmm. So I can't answer that because I don't know all of the SAWS portals. For the CalWin counties, so for San Francisco, if you were to go through My Benefits CalWin, I know that there's very minimal things that you need to do for a CalFresh app. Mm-hmm. So if you were to do that and also have a referral for Medi-Cal, again, we would follow up. If you indicated in the application that you wanted to apply for Medi-Cal, we would do a follow-up to get the appropriate, breadth of data for the application in order to process you for the Medi-Cal piece.
Great. So this is in reference to one of the slides that you had on earlier. It's referring to, I think you said that 98% of people who are eligible for Medi-Cal would then be eligible for CalFresh, but on the other side of that, it was something like 63% of CalFresh participants would then be eligible for Medi-Cal. So how is it that someone is eligible for CalFresh but not for Medi-Cal?
Okay, so let me see, 98% of people eligible for SNAP will be eligible for Medicaid. Mm-hmm. And 60% of people eligible for Medicaid will be eligible for SNAP. So, sorry, my brain's working the figure. People eligible for Medicaid will be eligible for SNAP. So then that means.
Kim, do you want me to jump in?
Yeah, thank you, Kim. Yeah, because my brain's not. Yeah.
Sure. So part of it is, of course, that the programs do have different rules, slightly different rules on things like drug felons, on things like students, on things like immigrants. You guys probably know more than me about that. In terms of when you get down to the details, there are some differences. Even though the income limits are largely overlapping, there are other rules. Who do you live with? Who do you file taxes with? Those kinds of things that will be different. But the other reason why it's so different in terms of 60 versus 90 in terms of scale is that in California, remember, we do Medi-Cal for kids up to $250 because we've taken healthy families and put it into Medi-Cal. So some of those kids who are in a house at 200% of poverty will get Medi-Cal and may not get SNAP. That would be my very short answer. But Angela, do you want to fill that out too?
Yeah, thanks, Kim. And I know there also has been coming up the discussion about how the households, and I think you just touched on that, there are questions about how the households are figured differently between the two programs. So I'm assuming that's probably a piece of this too, right?
Right. I mean, for most people, many people who you pay taxes with, which is the Medi-Cal income determination, and who you eat your food with, which is the food stamp household determination, are the same. But that's not always the case, of course. And people who are doubling up in houses, who may be a multi-generational family, maybe eating together but filing their taxes differently. So this number really does, like all good data, have a lot of caveats, especially when you get down to the California. But the point really is, and that's kind of a good segue, although I don't want to cut off the question, so what I want to talk about is how the bottom line is the majority of families, and again, Angela was very clear, this is not seniors, so under 65, the majority of people you help who are under 65 should get both, should get Medi-Cal and food stamps. That's, if you take nothing away from this call, that's the most important data point, is that they have a Venn diagram in your head of the one circle of families who get Medi-Cal and one circle of families who get CalFresh. The overlapping part is bigger than the non-overlapping part. And that's what's so important about this call, is making sure that those of us who are serving those families and helping those families are helping them make that full connection.
Great, thank you. So one more question, also another reminder to type into the question box if you have any questions for Angela and or Kim coming up. How do we find in our own communities those people who are doing Covered California outreach?
So in terms of the certified enrollment entities?
Yeah, so you know, I work for the San Francisco Food Bank. Who would I contact, or what website would I go to find out what entities to refer our participants to?
So that's where I would go to, where did I put it? This slide, okay, I don't know if it caught up with me. Right now, you know, actually all the counties have asked for, from Covered California, a list of the certified enrollment entities for our county, and I think they're kind of catching up with that. So for now, I've found that the best way is to go to this link in the visit where it says Certified Enrollment Entities Locator. If you go to that link, what it will do is ask you to enter a zip code, and you can expand the search from 5 miles out to like 50 miles or something like that. And it'll list all of the certified enrollment entities for that area. I will say, though, that my understanding is the state is a little bit behind on getting those groups processed. So getting their badges out, getting them certified, those type of things. So they're catching up with that backload, and I suspect in the next couple of months we'll start to see those numbers climb. But right now there isn't a heck of a lot. I want to say it was less than 300 statewide. It might even be like 250 statewide, just because they're trying to catch up with everything since October 1st.
Great, thank you.
Sure.
So more of a process question. How long does the e-application take to complete, and what's the time frame for applicants to find out whether their applications are successful?
So that's a little bit of a tough question to answer. The online application is actually the same system that all of us use to process these applications. I'm not sure if you guys have seen this in the news, but the Covered California site has been a little bit buggy. Yeah, it's gone down a little bit. It's been a little bit buggy. My personal thought is, in the grand scheme, I think that the rollout has gone well in the grand scheme, given how massive this implementation is, and especially compared to the federal landscape. I think California is doing pretty well. But I will say that it probably really can't give you a straight answer yet, because the system itself hasn't really worked its kinks out. And outside of that, I would say it's the normal thing where it depends on if you have, 2 people in your household versus 10. It could vary. I am hearing about 30 to 40 minutes. You would kind of want to expect to sit down and have 30 to 40 minutes to do it. But I think that I'm not sure if that's incorporating the kind of bugginess of the system and how big the household is, that type of thing. But I'd probably throw that out there as a general.
Okay.
And then I would just add in a best case and worst case scenario. I mean, just from a rules perspective, the best case perspective is you get determined right then and there. Real time is the gold standard they're going for, and that's those electronic verifications where they verify your income by asking the IRS. They verify your immigration status by asking INS. So if all of those things work as designed, and you're a very straightforward, simple case, you can expect to be online, as Angela said, for 45 minutes or so, and then get immediately real-time approved.
So
on the other end of the spectrum,
real-time
determined to be eligible for Medi-Cal. That's real-time eligibility determination is the gold standard that we're shooting for. But as a matter of law, the counties have 45 days to make a Medi-Cal determination. So they could also say, hey, we can't verify your income, we need this, or we need a couple more things to get this all straightened out. And they have 45 days to make a determination.
Yeah.
Just
Thank
like
you, Kim.
CalFresh, you have 30.
Yeah. The other caveat I'd put, too, is there is a recognition also that in this first year, the federal data, all of that tax data and everything, might not be all there. So I think the general thought is come next year, when we have a full cycle of everybody, more consistently having their taxes and all that stuff, all that information and data that's supposed to be in there, come next year, it probably will be a much more streamlined and effective, efficient pinging of those electronic resources. But in this first year, I think everyone's kind of expecting that not all the data will be in there to be able to do that real-time determination, but that absolutely is the intention.
Great. So to follow up with that question, best case scenario, someone puts in all their information, they have all their verifications, it's a straightforward case. They're going to get some sort of email, or it's going to pop up on the screen, someone's going to call them, or how is the live translation of that?
So that I'll also have to caveat too that right, I know, and I should have started with, I usually start with this, I should have started with this, that a lot of these things, when I reference that we're literally making history, I can't emphasize that enough, that there are things that are literally changing on a day-to-day in terms of operations as we're figuring out a lot of these things. Now, in terms of when the client comes in to, I know from, if they go to Cover California or and it ends up with Medi-Cal or it comes to Medi-Cal, there are definitely notices that go out to let the client know where they are in the process, notices, NOAAs, notices of actions, all those things. So with the Cover California portion, though, I can't speak to that one as readily in terms of, I believe that there is some sort of letter that goes out that lets the client know. That
well, but Angela, I mean, in terms of how it's going to be, it's like any other website. Like if you're on the web page tells you are doing it. You're entering your data. You enter your income. The Cover California page says you appear to be eligible for Medi-Cal.
But is there something in the end? But is there something in the end that actually tells the client this is what you? It does. Yeah. Okay. So I'm not
in the model. I mean, again, with all the caveats that Lilian said, asking the question, right? The person's information can all be verified. And yes, they get the message that says, great, you're approved. Now the next thing we're going to do is go shop for insurance. Here are your 2 choices in your county. Pick. And yes, that's what the online experience is supposed to be like eBay or Travelocity. Again, this is the Covered California webpage, not the county's web pages, which are not automated like that, are not real time, are still in the land of NOAAs. But the Covered California one if the information can be verified, you'll get that message. If not, it will say more verification, more follow-up is needed. Here's what you do for that, and that's going to be working with the county.
Great, thank you. So 2 very brief last questions, and then we have to move on to Kim's presentation. So I think I heard you guys reference, is ACA or Covered California then administered county to county in California, or is it by the state, similar to CalFresh where we do county to county?
So that's actually administered. It's a little bit of both. So Cover California is actually administered by the state. However, the counties have the ability to actually enroll into Cover California. So the Magi Medi-Cal piece is county administered. The Cover California is state administered. But the counties do play a role, again, in enrolling into Cover California if the client comes directly to us through that channel. So it's really a collaboration between the two. But I would say I would split it between Cover California as the state, Medi-Cal is still county.
Okay, and then one last question about your presentation, Angela. if someone submits verifications for covered California, can those then be used for CalFresh and vice versa, for like a single app?
Yeah, and that's, yes, well, that's what I was talking about earlier with the Express Lane project. There is part of the ACA where there's a waiver, an ability to do a proposal for a waiver so that you can use the information seamlessly across the different programs, basically horizontal integration. So there is that project on the table right now that the state is talking to some of the counties to work out the details of what implementation would look like, and it's called the Express Lane project. That's exactly what it's looking at to do. And Kim, you might actually have more on that, and I don't know if you have any more details on that.
I will.
Okay, great.
I can talk now or do it in my spiel, either way.
Okay. Thank you, Angela, and hopefully you can stay on for another 14 minutes until we wrap up, just in case there's more questions about ACA Covered California. So next I would like to introduce Kim McCoy-Wade, who is a consultant to the Alliance to Transform CalFresh, which is a coalition of 7 CalFresh advocates, including CEFB, the California Food Policy Advocates, and the Western Center on Law and Poverty. And their focus is on boosting CalFresh participation to 75%. From, I believe we are at about 50% currently, and they would like to do this by 2016. We will have Kim speak for a few moments, and then we would like everyone to report out what's going on with ACA in their counties. If possible, please report out with the question box or in the chat box. Thank you. Go ahead, Kim.
Thanks. And I'll be brief because I'm lucky enough to have had the pleasure to present with Angela before, and she covers everything so well and so thoroughly. I just want to speak to what this really means for CalFresh, and then also from a little bit more of an advocate perspective, although certainly San Francisco is, I would say, the gold standard also in connecting clients, families to both these programs. So, as we all know, we are all trying to boost CalFresh participation in many, many different ways, and the Affordable Care Act is it is the one historical chance, not just for healthcare, but also, if you saw those numbers Angela put up, to really significantly boost your CalFresh participation in your county. So here are some of the things we've been working on as the Alliance on the advocacy. One, at the state level, it is that referral. If you do an online application through Covered California or a paper application through Covered California, we want to be sure you get referred to the county, and that should start happening. We really need to hear from you guys with confirmation that that's happening. The counties are getting the referrals from the online and paper app to Covered Cal. The other thing that's happening, and it's probably even more important for the families we serve, is what happens at the counties and the DSS level. Three points of contact for people we want to keep our eyes on. One is intake. When families walk in a county door, do a county online app, or do a county phone call, are they getting help with both? And we know that's the county's aspirations. They absolutely want to help families with everything. The question is, are they going to be able to if the healthcare tide becomes a flood, which again is the problem we all want to have, but we want to be sure the counties have what they need to help people, not just with the health that maybe got them in the door, but with the food. And let's face it, there may be people coming in the door for food. That's often a more urgent, pressing need for families, but they also help them with health. So that intake, is that integrated? Second is the research. All of you guys, your counties are now moving to semi-annual. Medi-Cal has annual. At those touch points, we want them to be, families to be re-upped for both, so they don't have to constantly be doing one set of renewals for Medi-Cal and one set for CalFresh. Some of that's going to require state and federal change, but we shouldn't have these siloed research renewals, so we're working on that. And then the third, right now, all of your counties should be doing very aggressive, and many are, in-reach. And by that I mean, in contrast to outreach, going out and beating the streets to find people, look at the people who are already being served by your county, by Medi-Cal, and make sure they're all on food stamps, or as many of them can be as possible. Counties are doing lots of creative things with mailings, pre-popped applications, calling, really trying to make sure they have maximized what we call dual participation, families who should be getting both. So that's one thing you could just talk to your county about. You know, what's your plan for intake for both these programs? What's your plan for restart and renewal for both these programs? And what are you doing for in-reach for these programs? And then the other thing that's happening that we're working on, as Angela mentioned, is this Express Lane. The latest I hear is this is going to start rolling out in the first quarter of the year. And for this group of us on the call, what it means is people who are already on CalFresh will be, their income will be determined for Medi-Cal. We won't have to re-verify, redo gee, are you income eligible? By virtue of being on food stamps, you are income eligible for health care, for Medi-Cal. So it won't boost the food stamp numbers, but it certainly will boost the health care numbers. Oregon just moved everybody on food stamps onto Medi-Cal this month and has closed 10% of their uninsured gap in their state. Arkansas did it and closed 50% of their uninsured gap. So I think what we're hearing from the state is that in the first quarter of 2014, they're going to come and raid the food stamp rolls, which is wonderful, and make sure everybody on the food stamp rolls has Medi-Cal. And we think that'll be a big step into closing the uninsured, and possibly another reason for you guys to tell folks to sign up for SNAP. It helps with Medi-Cal, you know, when you need it, and we certainly will help people be healthier. So those are kind of the fronts we're working on. The final thing I was going to say is exactly what Angela said, is that we really want the outreach networks to be doing two things. One is general information, you know, selling health insurance, promoting health insurance to people, and then pointing them to the right websites, the right phone numbers. But then second, knowing who your counterpart is. Who is the trusted community-based person who can sit with them, help them through the website or the phone call or the paper app, who can have that kind of in-depth assistance for folks who need that. It's really important that we not treat families as segregated by programs or siloed by programs, that we see that their entire health and nutrition needs and can help them. So with that, I want to leave more time for questions and discussion. I will say we have, I do want to hear through Stephanie, if you can share stories of what you're hearing on the ground from families and from counties trying to get help, trying to get food, how it's working well, how it could be working better. Some of the counties have really great ideas of things to do, but it does require state and federal rule change or resources, and we want to help make that possible. And then second, we have some tools with the Alliance for you, checklists of things to ask your county about, some graphs and flow charts of how applications should be flowing that can help you try to figure this out. We're hoping at the Alliance, as always, that we move away from the model of different states doing different things and having a range of best practices. We really want to move to a standard approach so that we get excellence everywhere for all consumers and get to the tipping point on this participation problem we've long struggled with. So let me stop with that and open the discussion back up for the group.
Well, thank you, Kim. So we have one question so far, and that's just mostly about your talking points. Would you be willing to share your key talking points with the audience?
Sure.
Just send it out to Stephanie later on. Okay. And then let's see. I think some more process questions for either Angela or Kim. If someone submits an application for CalFresh through a CBO, a community-based organization, will it be standard protocol for the county offices to follow up with them about Medi-Cal during the interview process? Also, please, folks, reminder to type in any questions, any comments, report outs about what's going on in your counties with Covered California ACA.
Angela, maybe you can give a more solid answer. I mean, my sense is that that's every county's intention. Even when someone does a single program app, whether it's online or in person, they say, can we interest you in healthcare or cash assistance, as the case may be, and that's going to be only more. But whether that's going, how standardized that's going to be across every county, every office, every worker, I don't know. Maybe you can speak to that, Angela?
Yeah, I was going to, oh, sorry, could you guys hear me?
Yes.
Yeah.
Okay. Yeah, I was going to say we're moving in that direction. I think right now we're starting to do some of that, but I'll be honest, it depends on which office you're going to, but we're definitely moving in that direction. I think it's just what Kim said. I think the county offices will differ depending on what county you're in, but I think we're all moving in that direction.
One thing you can be sure and find out in your county is have they cross-trained the workers. Some counties have long had CalFresh, and you guys know this better than me, CalFresh workers and the Medi-Cal workers for a variety of good reasons, and more that's the old model, and the new model is that workers, partly because Medi-Cal is simpler now, thank goodness, but it's cross-trained. The worker who answers the phone, the worker who helps you is able to do the application on all those programs. But that's a trend more than a universal reality, I would say.
So, Liliana, also I should mention, I think when you said a CalFresh app via a CBO, my assumption is they're doing that through an online portal like Benefits CalWin or See for Yourself or whatever the LA version is.
Yes, I think.
Yeah, I know.
Correct.
Okay, great. So I know for us, if they're applying through the My Benefits Cal Win app, there is a spot for them to check if they want to be referred for the Medi-Cal. So I would definitely, if they do that, obviously we will take an application and we will assess them currently for current Medi-Cal as well as future or what would, the January 1st program. So I would definitely make sure that they do that.
Great. Let's see. Any more questions? I might have to call on some people who I can see are
Well,
on.
I guess, Angela, I was going to ask you a question if I can do that.
Go ahead, go ahead.
Do you think it's fair to say that outreach folks, CalFresh outreach workers should continue, their first referral should be to the county because the county is set up to handle food and cash and health all together? Whereas if you're an outreach person, you send someone to Covered California by definition does health first, and then gives you a secondary referral to food and cash, which needs follow-up. But in terms of doing it all at once, the only place that's going to happen is the county.
Yeah, and this is where I would have to defer to the local county operations. I know here in San Francisco our message is definitely, particularly for the lower income population or anyone who's our existing client, we would go ahead and say to come to Human Services first. But of course we don't want to dilute the message of if they're more comfortable going to a community organization or doing it online. And the real message we have here in San Francisco is all doors are right. Don't worry about it. Just we're more concerned about just get to us. But I would say if they're looking for a direction, come to Human Services.
Yeah, that's my sense too. Is that any door works, but the Covered California doors are health first, then food and cash, whereas the county doors are health, food, and cash together.
Yeah, exactly.
At least that's the design. That's the design. And so for those of you who are doing CalFresh outreach on this call, that might be the place to go. But you're right, Angela. People are going to need to. Some of this is going to be trial and error, and see what gets the best service for people, particularly in these first 6-9 months as everybody's learning how to run.
Yeah. My main thing really is that I don't want to lose the touch. So wherever that person's going to feel most comfortable, I want to grab them, and then I can get them into everything else. Versus if there's a whatever reason they don't feel comfortable coming to Human Services, but they might be eligible to CalFresh, particularly like I know in San Francisco we're talking about a senior Asian population may not feel comfortable coming to Human Services, but maybe they feel comfortable going to Covered California. Well, then I get the touch, and then I can pull them in and see what else they're eligible to.
Got it.
So Kim, it doesn't seem like we have any volunteers that are typing in to say what's going on in their counties. Would it be possible for them, if there is something going on that they would want to report out privately, could they send that information to you directly?
Sure. Me or Stephanie are happy to take that. And I'm also, I've been talking to a small number of counties who have actually sat down with their county welfare human services director to really understand all the changes. As Angela said, I think on her first slide, this is the biggest change for them in since welfare reform. So it really is a wonderful time to go and meet with them or ask for a briefing at your regular meeting and hear all the changes that are happening. I know in Alameda they're opening up a call center. There's cross-training happening in counties all over the state. So it's more than fine if you anything you know now I'd love to hear. And if you go out of this call are inspired to go sit down and learn more, I'd love to hear. And if you want to do some more prep before you have that meeting, I'm happy to talk to you more too. Have been helping people in San Diego and LA and San Francisco and Alameda start to have those conversations because it is happening now. So it's really just a perfect time to dive deeper in. And it's so important you understand what's happening to the applications that you're assisting. Is anything changing with how they're being routed, how they're being prioritized, who's responding to them? You really want to make sure all your work on the front end continues to go through as well as it can.
Okay, so we do have one report out and one question. We only have about a minute. So if I can, let's see, a report out from Anna Dyer over at Second Harvest Food Bank of Santa Clara and San Mateo. They're meeting with their counties, San Mateo County, November 5th, to discuss the rollout. And Santa Clara is willing to do special mailing to all getting Medi-Cal and not getting CalFresh, so just to promote the program. One question for both of you. Do either of you foresee a problem if someone is assisted with Covered California in the office, but then they are sent to social services for help obtaining CalFresh? And I guess, do you guys possibly see a problem with duplication?
No, I actually, the
Say no.
problem, I worry the other way. I worry the other, so first of all, just to be really clear, if you call Covered California on the phone, you'll be transferred to, in your low income, you're transferred to the county.
Okay.
If you want to talk to, if you walk into an office, there are no Covered California offices, there are only county. The county's going to help with all that. But let's say you do the Covered California online. As Angela said, it's a referral. And so I have to say, with all respect and faith in my county counterparts, I am very interested to hear what happens to those referrals to the counties. Because that is not actually a CalFresh application that has started the 30-day clock. So what, as Angela says, once you're touched, I'm going to follow up and pick up with you. I want to make sure that happens systemically in all 58 counties. So I'm a little concerned about the handoff, the baton being passed.
Mm-hmm.
But the two, and the other piece, that's the front end. The other piece, of course, that we're all holding our breath on is this new Covered California database, and the existing county SAWS databases do not yet talk to each other. So there is dual entry and there is duplication happening right now. But the last I heard was that everyone is still very hopeful that on January 1st, the bridge will be built and the data will go back and forth. So what you tell Covered California, SAWS will know, and to some extent vice versa. But that is true. That data IT, we're still waiting so that there isn't duplication, or really more for the workers, it's dual entry. The workers are trying to ask the client once, but type it into two databases for another 10 weeks until the databases talk to each other. But moving forward, I'm not so much worried about dual as I am about the handoff not getting dropped.
Great, thank you so much. So with that, I think we're going to close things out. Just some reminders to everyone still listening in. There are a few evaluation questions at the end when you close out. So please, please, please take a minute to fill those evaluation questions out. And thank you so much to Kim McCoy-Wade from the Alliance to Transform CalFresh and Angela Shing with the San Francisco Human Services Agency. We all in our network really, really appreciate the information, and we look forward to reading it when it's available online at the CAFB website. So thank you all, and goodbye.